So, welcome back to the first Core-Kinetic podcast in just over 2 years. I started the Core-Kinetic podcast just at the beginning of lockdown in 2020, and it ran till about the middle of 2022. And to be honest, I think I probably had a bit of fatigue from lockdown, a bit of fatigue from searching for guests, and yeah, just felt it was the right time to close it down. But I've had some inspiration. I feel like now is the right time to bring it back, but I'm going to do it a bit differently. I'm not going to get guests and, do it in that kind of format. What I'd love to do is make it really useful and relevant to the people that listen. So I'm going to be trying to find out what people want to know about. I'm going to make it time efficient, and I'm going to try and do short 20-minute bursts of relevant subjects that we can, have a quick chat about, probably mostly me and my opinions and my biases. But maybe we'll get some guests, maybe we'll do some different things, but it might be a little choose your own adventure. And I hope you enjoy that. And I hope that inspires you to listen. Now, the first one that we're going to do back, this is August 2024, is about reading a research paper. And I think this is something that quite a few people struggle with, is what are they looking for? What is good research? What is bad research? And so I'm going to try to, in a short space of time, think about how would I go through a paper quick and dirty and try and see if that is of some value to you. So we always start with the abstract. Now, you should never make a judgment about a paper simply from the abstract, right? But you can make a judgment about, is it something that I need to read? So if I look at a paper and it interests me, it's in a topic that I find interesting, maybe I know some of the authors or I recognize some of the authors, it does allow me to make a judgment and say, is this something I'm going to download or try and get the full text? And then we can dive in and get, deeper into that. So the abstract doesn't allow me to make a judgment on the paper, but it does allow me to gauge my interest. And really, it's just an interest screen. Is this something that interests me? Is it something that's relevant to me? Is it something that I would like to dive a little bit further in? So if we dive in, then we get into the abstract. All right, and the abstract is really about why do we need this paper, okay? So understanding why we may be interested in looking at this paper and why the authors have actually gone about and done it. So generally we will see some background information and we see some kind of epidemiology or etiology around the problem. And really, I think this is really, really good information when it comes to education. If we take a back pain paper, in the introduction, it will tell us about, it's the, most problematic musculoskeletal condition. It might give us some data about incidence or prevalence. It might give us some data about kind of the natural history, how long it tends to go on for, etc. It might give us some information about how they're defining lower back pain, all right? And I think that's really, really important for us to then sometimes use educationally with some of our patients. So that's some really interesting stuff. And I know sometimes people look at the introduction, they find it a bit boring. I actually think it's a real kind of gold mine, not a minefield, a gold mine of interesting stuff that we can then use to kind of define what we're talking about and use for things like helping patients understand the problem as well. And also with all of these things, it points us in the direction of other research. So we might find some interesting information about back pain, nice little reference. I might look at that paper and that leads me on to another paper that might be specifically about epidemiology or some other really interesting information about lower back pain, all right? So that's really important. Now, the other thing that I want out of the introduction is a bit of a rationale about why they're doing it. And again, that might refer to some other literature that's found similar findings. But what I'd really like to know, and I think this is often when people are good at what's called consult guidelines, which is about how you report a paper, is they will give you their objectives, and that might be to find out if a certain group is better than another group. Let's say we have a 3-arm trial, exercise versus manual therapy versus exercise, manual therapy, and education, for example. It will tell you exactly the reason why they're doing it, what they're looking to test. And then also it might give you their hypothesis about what they expect to find. And I think sometimes that gives us an idea about author bias. It might be that if we have two groups, one is education versus exercise, the authors might hypothesize that education and exercise is going to be superior to exercise alone. All right. So so why are they doing it? You know, what is the exact kind of reason for the study? And then also, what is their hypothesis about what they're going to find? Again, that might lead you to think about author bias, and that would be adherence to the consult guidelines, which is a specific way of reporting. And anytime you see consult, generally it's reported, I think, in a better way, and we tend to see more adherence to consult guidelines over the past 3 or 4 years. All right, so the introduction isn't boring, gives us an idea of rationale, and then it also gives us an idea of what the hypothesis here is going to be. All right, so then we get on to the methods, and I think the methods are the most important part of a research paper. It's telling us how they did it, and this helps with the idea of external validity. So external validity just helps us understand, you know, how externally valid, Ben, how externally valid this is actually going to be, and how well done it is as well. All right, so good methods make a paper. If the methods are poor, then the results are not generally generalizable. We could say the external validity is quite poor. And also, it's just, you know, if we can find methodological flaws, and I struggle to say that, methodological flaws, then, you know, the outcome and the results are often less valid, less interesting, less something that we can take notice of. All right, so firstly, we may look at things like inclusion and exclusion criteria. Who is being studied here? What kind of age range? That might be important, especially if we are looking at a specific problem or pathology. If the age range being studied is 18 to 25, but we're looking at osteoarthritis, of course that's not going to work. Or if we're looking at patellar tendinopathy and we're looking at 50-year-olds, again, that might not work because we know that the key age groups may be 18 to 30. So are the people being studied, are they reflective of the problem that's also being looked at? Now, again, we might see how long have these people had pain for? What are some of the tests that they use to include these people? So if the test for the pathology isn't very good, then how do we know we are studying the right people? Again, that might be a methodological flaw. And then we might look at the exclusion criteria. Now, sometimes we exclude people with comorbidity, for example. And again, that may reduce the external validity of a paper because because comorbidity is very prevalent in chronic back pain, for example. We would also be looking potentially at, you know, things like excluding people that may not have the specific issue that we're looking for. So if you're studying subacromial pain, if someone's had a recent frozen shoulder, if someone's had some kind of recent surgery, again, that's going to be an exclusion criteria to make sure the group that are being studied are the group of interest. So the inclusion and exclusion criteria, tests that are being used, the group that's being studied, these are really important things. Now, moving on, we would like to see randomization, for example. So if it's a randomized controlled trial, we would like to see how did they randomize. Was it through an opaque envelope? Was it through some kind of number sequence generation? Again, you can dig into that and decide, is that a kind of valid method for doing it? We'd like to see some of the blinding. Now, not everything needs to be quadruple blind, even the person reading the study, right? But we would like to see the outcome assessor at least, or the statisticians, being blinded. And the reason for that is because that's really what things like the Cochrane risk of bias would suggest that needs to happen. So not everyone needs to be blinded. Very, very difficult to blind exercise studies, which means that not everyone can be blinded, but the person that we need to see blinded is the outcome assessor. And again, all of these things are about reducing bias. So a randomized controlled trial at its heart is trying to compare different groups, of course, but it's also using specific methods such as randomization, such as blinding, to reduce the bias that might come through not using some of those methods. So they're the things that you want to kind of look out for. Now, we'd also want to know about the intervention, and we see the methods section generally is the biggest because it includes the most information. Methods section is going to give us an idea of the intervention group, what they did, and the control group. So often these aren't always well reported. We know that exercise trials, for example, aren't always well reported about what actually happened. And sometimes they'll refer to some kind of supplementary material somewhere else in the ether, maybe in the dark web. We don't know. So we want to look at the intervention methods or the control group. What did they get? Were they kind of equal? So were the time that people spent with each other matched? We would like to know, did one group receive loads more treatment than another group? And also, is it relevant? Is this good treatment? Is this something that we would say is evidence-based in to some degree? And so has that previously been studied? What are they referring to when it comes to deciding about this treatment? So moving on, outcome measure. So what are they actually using to measure the outcomes? So this could be a singular outcome measure. So pain or disability, you know, we might use an NRPS or a Roland Morris for a disability, or is it a composite score? So something like a COOS or a SPADI, or my mind's gone a little blank there on other outcome measures like a Visa A or a Visa P for patella, Visa A for Achilles. And these are composite measures that usually include some aspects of function, some aspects of pain, etc. So a SPADI would be composite, a COOS would be a composite for the knee. We might see an Oxford shoulder score, again that is another composite measure, or we might see more standalone measures. A quick dash is a dash or a quick dash is another one for the shoulder. Again, they try to capture multiple domains within one kind of outcome measure or one score, generally score that out of 100. Or is it lower, more like an 11-point NRPS or a 100-point NRPS? So generally we'd like to know the primary outcome measure. We'd like to know some of the other secondary outcome measures as well. Now, often the paper will only be powered for that primary outcome measure, meaning we need to be a little cautious sometimes of those secondary outcome measures. We would like to know, is there a power calculation? So how did they decide how many people to have in a study? One of the things we often hear is, oh, the sample was small. It doesn't matter if the sample is small if there is a power calculation. If someone has worked out how many people do we need to find a minimum size of an effect. So let's say we take a SPADI and we say we need to find the minimal clinical important difference. So what's the smallest difference that a patient might find relevant? So then we need to work out how many people do we need to detect that size of difference, and that's called a power calculation. And then we have a specific sample size, and it's not just plucked out of thin air. It's not a small or a big sample, it's a calculated sample, but generally, as I talked about before, that will generally be for the primary outcome measure. There's not a calculation for every outcome measure. That's why we need sometimes to think about secondary outcomes and how much we can hang our hat on those. So the methods is the bit that really tells us how is it done, and we can decide, is this a good bit of research or is it a bad bit of research? Does it have some of these methodological flaws that might reduce its external use or its external validity. Again, if we have a group of 19 to 21-year-olds being studied for OA, it's not going to have much external validity to most of the people that would develop OA. All right, so the results, this is another important section. Again, this should be reported without any kind of bias or without any kind of reasoning. It's just the results. This is what happened. And this is where we might see graphs, we might see data, etc. So it's without interpretation. This is your chance to do the interpretation, to say that, you know, this is this is how I would interpret this data based on the methods that are being used. And it should be presented in a nice logical sequence. Sometimes the wording can actually be quite difficult. And I actually find the results sections one of the most difficult to read and make sense of. Lots of numbers, lots of charts, lots of data, lots of things in brackets, etc. Lots of not much plain language used, very kind of, not very conversational, very kind of matter of fact. And again, that can be quite hard to interpret as well. But we should see things like, what was the effect size? So the effect size should be, what is the difference between the two groups being studied? So what is the actual difference? An effect size can be a calculated effect size. So we might see like a Cohen's or something like that, which takes into account things like standard deviations. Or we might see just a single numerical effect size, which is just reporting the difference in the outcome measure between two groups. Sometimes people try to put a bit of spin on stuff. So they report within group change. That might just be to do with time. It's nothing to do with intervention. So that's why we need the between group measure, which we would call the effect size. And then we're going to look to see, does that reach this MCID, or is it just statistically significant, or is it not significant at all? All right, but that's where we actually get the data. But again, sometimes it can be a little hard to pull out. Now, the discussion. This is where people are trying to make sense of the results. So the discussion is where we take the findings of the paper and we compare them against other findings of similar research. So it might say we found X in our paper, but in this other paper, they found something completely different. And then we might give reasons why there are these differences. Are they methodological reasons, such as difference in sample size, difference in intervention, different inclusion, exclusion, difference in, whatever measure we're talking about? Or are these things very similar and we've got different results and who knows why? All right, so that's really interesting as well. But the discussion might give us, again, other interesting avenues into other papers that can be interesting. And we should also see strengths and limitations. So strengths might be, certain kind of methodological strength. So who was studied, size of the group, the program that was used. And then limitations can sometimes be how many people dropped out of the study, for example. So if we had half the people drop out, then the power calculation's worth nothing. And we don't have the statistical power that was originally discussed. So that's really interesting as well. And then finally, we get into the world of the conclusion. The conclusion should just state what has been said and what has been discussed. Again, a little bit like the abstract. We should never really just listen and look at the discussion on its own. The conclusion on its own, because sometimes there can be a little bit of spin put into that. And again, that might depend on the author's bias. We could go back and look at their hypothesis and say, I can understand they might be invested in this type of outcome. And that's been reported in the conclusion. But I don't think the methods and I don't think the results actually support that. Sometimes people report really, really small differences as being a little bit more significant than they are. Maybe they don't reach a clinical significance, but they might be close to statistical significance. But really, if we've set those markers, if you don't reach them, then you can't really state that one group is bigger than another, because otherwise, what's the point in talking about the markers in the beginning? So look, I've tried to do that nice 20 minutes, down and dirty. That's kind of what I'm looking for in a research paper. And there's lots and lots of them out there. Reading research is about doing the reps. If you do the reps, you are going to get better at doing it, but it's also nice to have a little bit of knowledge about, what's going on. So I hope you found that helpful as the first episode back of the Cor-Kinetic podcast. A little info snack, and we'll see you next time.